Welcome back, everybody. I'm the Dr. Bob Lee, and our next guest is the founder and president and CEO of Depressed Black Gay Men, and he's here with us today. Antoine Craigwell, welcome back.
Thank you very much, Bob Lee, and how are you doing?
Great. These are different situations, different times. We're not in the BronxNet studios. We're in our personal studios. And how are you making out?
This is particularly challenging. Personally, when the pandemic hit, I'm accustomed to I work from home, so I'm at home a lot. So yeah. There's not really a problem with working from home. But when the pandemic hit and we were put on all these lockdowns and social isolation, social distancing and isolating, and we couldn't go out except to the pharmacy or the supermarket or the post office or the bank, it became for me the equivalent of minimum security prison. I can go out, but I have to get back home. And it became like during winter, when I want to go downstairs just to take out the garbage, I have to put on several layers.
Yeah.
Now, when I'm going out, I have to put on masks, gloves, make sure that I'm covered. And so it becomes difficult. And then trying to relate to people when they're at home, and people think that working from home is a peach. It's a holiday, it's a vacation. But it's actually much more difficult, and you actually work longer hours.
Yeah.
And so now there are greater demands on people's time because they are trying to counteract the expectation that because they're at home, they're lollygagging and they're not being productive as they should. So people at home are trying to catch up and do as much more, so they don't have time.
Give us a little overview of your organization and tell us what you're doing during this pandemic and through the protesting and everything.
Well, one of the things that we have recognized is necessary is focusing on the mental health for our communities.
Yeah.
Because coronavirus, when it hit with the social distancing and isolation, created an additional imposition on people of color mental health.
Yeah.
When we saw that in April and in May, we saw the spikes in the number of deaths, the equivalent of sometimes 28 to 30 deaths an hour in New York City, it began to make people feel afraid. It began to make people think, am I next? And that, on top of being isolated, now if there are two different types of isolation here. There's the isolation of living by yourself.
Yes.
And so if something were to happen to me, what would happen? Who would know? Would people only know about me when I start to smell? Or there's the isolation that comes with living among family. And for many LGBT people of color who are living among family, they are not out to their families. And so it's an additional burden on them to try to keep their sexual orientation or gender identity hidden while being among their family. And especially for those of color who are taking medication for HIV, they've got to find ways to hide that medication because they no longer have the opportunity or the ways in which they can find other ways to take the medication safely. And so there may also be instances of domestic violence or intimate partner violence in the household. So there are a lot of additional stressors and anxiety that builds on top of people.
How do you compare the two? There was the HIV AIDS epidemic when it first came out in the 80s. How do you compare it to COVID-19?
They're both pandemics, and there are a lot of similarities more than differences. So let's talk about the similarities, the commonalities.
Okay.
First of all, it's a pandemic. Second of all, as a pandemic that has spread globally, it is immaterial where the pandemic began. The fact is that it is here. Second, it is affecting and devastating communities of color particularly. That was one of the instances with HIV back in the 1980s. It was celebrated as the white gay disease, but unbeknownst or unacknowledged, thousands and thousands of Black and Latino gay men were also being affected. Third, there has been a consistent denial by both the federal government and the state government and city government to address the pandemic COVID, as was the case back in the 1980s with HIV. And so by the time this federal, state, and local governments got their act together, thousands have died. And so what we are seeing also is that the city and the state, and God knows what the federal government is doing, is belatedly getting behind a contact and trace process. When contact and trace were one of the key factors used to eliminate or reduce HIV spread in the 90s, one of the differences now that we see with COVID-19 versus HIV is that with COVID-19, it doesn't discriminate. It goes across the board between gay, straight, Black, male, Black, female. Yeah. Originally with HIV, it was predominantly among the gay community and the transgender community. But then it started to spread in the late 90s to straight men and straight women and the elderly. So it started to disperse within the community. But originally, there was a high incidence in the Black and Latino gay communities.
Now, when you look out and you see people protesting, you see people of many different backgrounds. What do you have to say about that? Are they more at risk of getting COVID-19 from being out in close quarters together?
Most certainly. Think about it. We have seen reports from public health officials that are saying that a couple of things are kind of counterproductive and counterintuitive.
Yeah.
One is that because we have been lulled into the false sense of complacency, thinking that the numbers of infections and deaths have dropped, that it means in correlation, we can go ahead and relax restrictions. But we also know that following George Floyd's murder last Monday, okay, and the massive protest that has erupted because another Black man was killed by a white police officer, is perpetuating and continuing a particular kind of trope that many people decided to hell with the coronavirus. I need to get justice. We need to get justice, not just for George Floyd. We need to get justice for all the Black people who have been killed by police and law enforcement, but also to express our fear that we may be next, just like coronavirus.
And where can we go to get more information? Because you're a wealth of information. I know a lot of people are calling you because of the position that you're in right now. You're taking on, what do they call you briefly? They call you mostly for what these days?
Mostly for information about how to navigate, what to do, but sometimes often just to talk, just to connect. So like I started a Facebook group called I am here for you, calling 10. And I've invited people to call 10 people once a day or once a week.
That's a good idea. That's a good idea.
So that if I send you a text, Bob, and I said, Bob, how are you doing? You're going to respond, fine. I don't know, Bob, if you are fine. But if I pick up the phone and I call you,
can hear it in
Bob,
the
how
voice.
are you doing? Exactly. And I said, how are you doing, Bob? And Bob says, I'm fine. I said, no, let's start again, because that doesn't sound fine to me.
Yeah.
I said, let's start again. How are you really doing, Bob? And then we are able to enter into the conversation.
Thank you so much. Antoine Craigwell, founder, president, CEO, Depressed Black gay men. Thank you so much for all the work that you're doing in our community. We really, really appreciate you. Hope to have you back soon. All right.
Thanks again, Bob.
You got it.
Good.
All
Okay,
right. We'll
bye.
take a break. We've got more open. Stay right there.